Kia ora everyone. So welcome to today's chair yoga class. We'll be focusing on the psoas muscle. And the psoas muscle is a big muscle that connects the lower back through the hips to your legs. And if you do a lot of sitting, or you get lower back pain, or if you find yourself quite unstable when you're standing and walking, then this class can help you. So you will need a strap of some sort. It could be a scarf or a yoga strap, and of course a chair. Okay, so let's begin. So first of all, just begin by moving from side to side, and then we're going to start to walk the butt backwards and forwards on the chair. So feeling both the left and the right sit bones, both the left and the right sides of the body. Oops, I'll just put the strap to the side. And just notice what you're feeling, especially in the lower back as you move from side to side, noticing any differences between the left and the right sides of the hips. Okay, and then you'll walk forward again and just come to a place where your feet are on the ground, you feel stable, and maybe just moving a couple of times backwards from side to side just to find that balance between the left and the right sides. Okay, and then you'll take your strap around your rib cage. And so it comes around the lower ribs. And then you want to cross it over in front of you. So you've got a cross just in front of your lower chest, lower ribs. And then just holding onto the strap. So we're going to just do a few rounds of breathing into the strap. And for this particular breathing for today's class, we're going to be focusing on any sensations you can feel in the lower back. So the psoas muscle is connected through fascia to the diaphragm. So it's really integral in with our breathing, and so if you have a tight psoas muscle, this can also limit the capacity for your breathing. So we'll begin by just taking normal breaths in and out through your nose. And if you have difficulty breathing in and out through your nose, of course just breathe in any way that feels comfortable for you. And start to pay attention to the sensations that you feel, the rib cage as you breathe in, pushing into the strap. And as you exhale, you may feel the rib cage drawing slightly down and in. You may have to gently pull on the strap. And you may even like to close your eyes here. And just pay attention to the area around the back of the strap and down towards the lower back. Notice if there's any sensations. Or if there's any pain or tenderness or tightness that you may feel. Let's just do another couple of cycles of breath. And then you'll slowly release the strap, just putting the strap down. Then we'll come into some arching and curling. So hands on the fronts of your thighs. You'll push your hands into your thighs, lengthen the arms, and then start to round into the back, maybe tucking your chin under. And then you'll pull on your thighs and start to lift your chest up towards the ceiling, lifting your gaze if that's comfortable for your neck. And then rounding. And again, just lifting the sternum, top of your chest up towards the ceiling, gaze up. And then again, flexing the spine, tucking the chin in. And extending the spine as you lift the sternum, the top of your chest up. Okay, and you can just continue with that movement, or we can start to go a little bit deeper by taking your hands, either one behind the other, or just stacking your hands behind your head. And then again, you start to round, chin may tuck in, and then rounding as much as feels comfortable for you. And then you start to lift. You can take your elbows wide, lifting the chest up towards the ceiling. And then again, flexing the spine, so coming forward and rounding. And then extending the spine. Let's do one more full cycle. Notice how you're feeling in the spine today. And come back to a neutral position, just release your arms down. So we'll take the hands now onto either side of your pelvis, onto your hips. And you're going to start to do some pelvic tilts. So you're rocking the pelvis forward. So you almost want to visualize that the pelvis bowl is like a soup bowl. And as you tip the pelvis forward, you'll be tipping the water out. And then as you tip the pelvis back, you'll be pouring the water out behind you. So you tip the pelvis forward. And then using your hands to guide the pelvis back. And then again, pelvis tips forwards. And it's quite a small, subtle movement. And then tip the pelvis back. And pay attention to these sensations in the lower back. So as you tip the pelvis forward, you're creating more of an arch into your lumbar spine, into your lower back. And then as you tip the pelvis back, you're lengthening the spine. And so you may feel a bit of a release in the lower back. Let's just do one more cycle. So again, tip the pelvis forwards and then tip the pelvis back to that posterior tilt. And then come back to a neutral position. So a neutral position is where the pelvis is neither tipped forward nor tipped back. Okay, and then just take a couple of moments and just notice what you're feeling, sensations that you may be experiencing in the body. And then we'll step the feet wide. So we'll come into a goddess pose. Again, hands onto your thighs, and we're just going to circle the torso around. And these can be as big or as small circles as feels comfortable for you. Almost like you're moving the torso around in the pelvis, and you're just going from side, back, inside and forwards. And so you may even feel the pelvis doing this, like tilting forwards and tilting back as you do this. Okay, let's come around in the opposite direction. And do note if this side feels, or this direction feels any different from the other direction. Go one more full circle. And come back to center. Again, step your feet in a little bit closer. So they're about hip-width distance apart. Okay, let's come into lateral spinal flexion. So that's where you're creating an arc with the spine. So you can either take your right hand down to the chair leg or just hand onto your hip, and then reach your left arm up towards the ceiling. And you're going to push down through the sit bone, down through your foot as you lengthen up through the rib cage, through the arm. And then you start to flex over. And just keep it a very small movement. Just breathing here. Visualize that you're breathing right into this left side. Again, can you observe the diaphragm, psoas muscles connection? Just take another couple of cycles of breath here. If it gets too much with your arm up, you can just release it down alongside you. Keep pushing down into your foot, down into your sit bone, and lifting up through the waist, the rib cage. Okay, now from here we're going to start to tip the torso forward. So you're reaching your left arm towards the right corner of the room. And it's just a very small movement. You're just opening up a little bit more into the mid to upper back. Keep pushing down into your foot. So left foot down to the ground. And then lifting up. Release your arm down, and you can give your shoulders a little bit of a shake. Let's switch sides. So again, left hand either onto the chair or onto your hip. Reach your right arm up, so your palm will be facing towards the left side of the room. Now anchor down through your foot, so push down through the foot, down through your sit bone, and lift up through the ribs, up through your arm. And then you start to flex over. And so when you flex, try not to lift the right side of the hip up, or your right buttock up. Again, just stay within your comfortable range of movement and start to visualize breathing into the right side. You can even use your left hand onto those right ribs just to feel the breath. Expanding into the right ribs. Okay, now from here we're going to start to tip forward. So you'll start to reach your right arm towards the left corner of the room. And again, it's a subtle movement. Your gaze will come towards the ground. Again, stay anchored through the buttock and your right foot. And then make your way back up. Release your arm down, and again, just give your shoulders a shake and maybe taking one arm in front of the other across your body. Okay. So just again, readjust your sit bones, and then you'll lift up your right leg, just hovering your foot above the ground. So this is a great way to start to build strength into the hip flexor muscles. So you just lower the foot, and then we'll lift and lower. Again, just lift, just hold and lower. Do a couple more rounds of lift and lower. And then we're going to hold. So lift up, you'll take your right hand and push it against your thigh. And you keep pushing your thigh into your hand down into your thigh. You should start to feel a juicy contraction. If it gets too intense, you can release it at any time. And try not to hold your breath here, so keep breathing. Take another full cycle of breath. And then release, and then you maybe tap out the front of the thigh. And then let's switch sides to the left side. So again, you hover your left foot up, just hold there for a brief second, and then you lower back down. And again, just lift and lower. And lift and lower. Do another couple of rounds, and then we'll hold. So lift, lower, and now let's hold. So you're hovering your foot above the ground. Now push your left hand into your thigh and your thigh in towards your hand. So as though you're trying to lift your thigh up towards the ceiling, your hand's trying to push it down towards the ground. So you're creating an isometric contraction where you're moving without moving. Take another 1 or 2 cycles of breath. And try not to hold your breath. And then you'll slowly release. And again, you can tap it out. Oh, that one can feel quite intense. Okay, so now step your left foot into the center, so center of your chair, and then take your right foot and under your chair, so your knee will be bent. Now we're going to start to open up the hip flexor, so you'll use your left leg to stabilize you so you don't fall off the chair, and start to slide your right foot under the chair, so you're starting to open up through the front of the thigh. And then we'll release, and we'll hug the thigh up and towards the chest. Okay, so again, you're flexing the leg at the hip, and then we'll take it long, and we'll start to bring the arms into it if that's possible. If you do need to hold on to your chair, you can continue to do so. So otherwise, you're reaching your arms up as you drop your knee down towards the ground. Take a nice deep breath in here. And then as you exhale, arms will come down, lift your thigh up. And then again, lowering the knee down, reaching your arms up, breathe in. And then as you exhale, hugging your thigh towards the chest, lower the arms down. Just stay with the breath. We'll do another 3 full rounds. Sliding your right foot back, reaching up through the arms, and then hugging the thigh in, lowering the arms. Last time. Okay, lower your foot down, just readjust yourself, and now you'll bring your right foot to the center of in the middle of your chair, and we'll slide your left foot underneath. And you can start off with, again, just by holding on to your chair, maybe the back or to the sides. Make sure you feel stable and you're really anchored down through that grounded foot. Okay, so lowering the knee towards the ground and then lifting the thigh up. And again, slide your foot down and back and then lifting. Okay, now we'll start to bring the arms into the movement. So knee drops down, reaching your arms up. Breathe in. And then as you exhale, pull the thigh in towards your chest. And then again, reaching up. And then pulling the thigh in towards your chest, lowering the arms down. 3 more to go. So can you feel that opening, that space, front of the pelvis, and then pulling your arms down as you lift the thigh. 2 to go. And last one, breathing in and breathing out. And lower your foot down. Just walk back to, move back to center, and maybe just shuffling your hips, walk out your legs. Okay, now we'll come to, we're facing the, more towards the right side of the room. You may want to hold on to the back of your chair, and we'll start to lower your left knee towards the ground. So we're kind of coming into a lunge position. You may need something underneath your right foot to help you stabilize here. As you get in, if you feel like you've got the range, you're going to start to slide your left leg back just until you start to feel a bit of an opening through the front of your left thigh. And you start to lift the knee up. Do watch what happens in the lower back. So if you're creating a big arch into the lower back, maybe don't take your legs so straight, just sitting up tall. Just breathing here and holding. Okay, bend your knee and place your foot back on the ground. Come back to center and then walking over so you're facing more towards the left corner. So you can, left foot stays facing towards the left, and then you'll drop your right knee towards the ground and hold on to your chair. Okay, so start off with by just lowering the knee towards the ground. Just holding here. And then if you feel like you've got the range, you'll start to slide your right leg back. Again, focusing on this front of the thigh. Just breathing here. Again, watch if you're creating a big arch into your lower back. Maybe you'll keep your knee slightly bent. Okay, and then slowly release. Walk your feet back to center. And you can just walk it out. Okay, then we'll come to take your right ankle onto your left thigh. If it doesn't reach the thigh, you can use a prop underneath your foot or resting your foot against your left leg. Okay, we want to sit up tall here, and we're going to be hinging from the hips. So rather than rounding at the waist to come forward, keep the spine long, take a nice deep breath in. And then as you exhale, you'll come slightly forward. And you'll come to a place where you're just starting to feel it into the outer right hip, maybe into the lower back. Just breathing here. Maybe coming a little bit further forward. That's within your range of movement. And then lifting your chest up, lower your right foot back to the ground, walk it out, and then let's switch sides. So you'll take your left ankle onto your right thigh, or again, you can place it in front. And this side could be different from the other side, so take it to where it feels right for this side. So again, sit up tall, lift up through the crown of your head, and then we hinge forward at the hips. And then again, just continue to breathe, try not to hold your breath. Notice how this side feels compared to the other side. And just finish the cycle of breath. Then you'll lift your chest and lower your foot back down to the ground. And then just walking your feet, so just lifting one leg and then the other, tapping it down or rubbing your thighs. And then we'll, again, how we started, just moving and walking up and down the chair. So just going from one side to the other, and just notice how you're feeling in the lower back and the hips. Okay, and then just making your way back to center, feet down, and hands onto the fronts of your thighs. And just stay here for a few breaths, just allow your nervous system to process all that's gone on. And thank you so much for joining me. Have an awesome day.